Have you ever been told to watch your thoughts? That your mind has power over your life? It might sound like a self-help cliche, but in psychiatry, we see it literally. These are people whose minds can convince their bodies they are pregnant. Their bellies grow, their hormones shift, they stop menstruating, they feel a baby kick, but when doctors check, there is no baby, no pregnancy at all. Hi, I'm Dr. Katia Batista, and I would like to tell you that this is not a story. This is a real condition and it's called pseudocyesis, false pregnancy, a very powerful and heartbreaking psychiatric phenomenon where the body responds to the belief of being pregnant. The mind creates symptoms. Pseudocyesis is not about lying or pretending. These individuals truly believe they are pregnant and their bodies reflects that belief. Is classified under somatic symptom disorder. In the DSM-5, the International Psychiatric Classification, stop menstruation, nausea, weight gain, breath changes, sensation of fetal movement. These are not hallucinations or delusions in the psychotic sense. Pseudocyesis reflects a deep mind-body reaction, a powerful psychosomatic condition rooted in trauma, grief, and overwhelming desire. What causes this? Often begins with a psychological trigger: infertility, repeated miscarriage, perinatal loss, or extreme fear or pressure to become pregnant. Imagine this: when someone deeply believes they are pregnant, their endocrine system, which is tightly connected to their brain, can start mimicking pregnancy signals. The hypothalamus, a small but powerful region in the brain that controls many body functions, becomes involved. It's influenced by intense emotional stress, trauma, or unfulfilled desire, and it can begin to alter hormone levels, especially prolactin and estrogen. These hormonal changes can then produce real physical symptoms, like I mentioned before: cessation of menstruation, abdominal enlargement, nausea, even sensations of real fetal movement. This is not malingering. These are not fabricated or fake. These changes are physiological, real, driven by the mind-body connection. Is a striking example of how powerful the mind can be and how our physiological state can directly affect the biology. It still happens, especially in areas with poor access to gynecological care. Can affect women in menopause, rarely men, but men also can be affected. Is what we call Kubath syndrome. Now imagine the emotional devastation when a doctor says you are not pregnant. After months of bodily changes, anticipation, even planning for a child, It's not just a disbelief, it's a loss. And here's the ethical challenge as clinicians. We cannot just say you are wrong. We have to understand this is not manipulation, it's suffering. Pseudocyesis often emerge from complex trauma, societal pressure, and unprocessed grief. Now that we have seen how powerful the mind can be in pseudocyesis, creating physical symptoms, hormonal change, and even abdominal distension, the natural question is, how do we treat something so deeply rooted in both mind and body? Let's explore the treatment step by step. Treating these conditions requires a careful multidisciplinary process. This condition sits at the crossroads of psychiatry, gynecology, endocrinology. The collaboration is essential. Gynecologists are often the first ones to assess the absence of pregnancy and rule out gynecological causes. Endocrinologists may evaluate hormonal imbalances such as hyperprolactinemia or pituitary dysfunction that may mimic pregnancy. Psychiatrists and psychotherapists assess underlying psychiatric or emotional causes. Fertility specialists may be involved when infertility trauma or reproductive loss is a contributing factor. This team approach ensures both the psychological and physiological aspects that have to be addressed with empathy and precision. Psychotherapy interventions are, like I said, essential. It's the core of treatment, but it's important to emphasize direct confrontation is not advised. The patient's belief is not simply false. It's psychologically real to them. Let's look at the key psychotherapeutic strategies. Supportive therapy. This is often the first and most essential step. Emotional validation is crucial. These patients may be dealing with unresolved grief, infertility, or trauma. The therapist provides emotional support, helping the patient gradually process their distress. Interpersonal therapy, IPT, especially helpful in cases involving low abandonment or unstable relationships. IPT helps patients explore how interpersonal dynamics may have contributed to the emotional distress that trigger these conditions. CBT, cognitive behavioral therapy, useful when the patient presents with intrusive thoughts, obsessive worries, or somatic anxiety. CBT focuses on helping the patient to understand the connection between thoughts, emotions, and physical sensations without invalidating their experience. Trauma-informed approaches. In patients with histories of sexual trauma, miscarriage, or perinatal loss, trauma-informed lens is essential. Processing unresolved grief or shame is the key to recovery. Medication is not always necessary, but in some cases it plays a supportive role, such as antidepressants like SSRI or SNRIs may help when the patient is also experiencing major depression or anxiety. Low dose of antipsychotics may be considered in cases where delusional conviction is present or the belief severely impairs functioning. Short-term medication may also help to regulate the sleep, appetite, or somatic symptoms when needed. Pharmacological treatment should always be adjunctive to psychotherapy, not a replacement. Pseudocyesis is more than a psychiatric rare condition. It's an example of how powerful and complex the human mind can be. It reminds us that behind every symptom there is a story, and healing begins when we approach that story with science, compassion, and empathy. About this condition, there is something as well, that the body listens to the mind. It's about the mind-body connection, about empathy, and about seeing beyond what seems medically impossible. If you want more content in exploring rare but real psychiatric conditions, subscribe, share this video, and leave a comment below. What has your mind convinced you of lately? Thank you.